Welcome everyone. Today we will discuss about partograph. The definition: it is a composite graphical recording of cervical dilatation and descent of head against duration of labor in hours. It also gives information about fetal and maternal condition that are all recorded on single sheet of paper. This is how parthographs look like. We will discuss. In history, E. A. Friedman in 1954 provided a foundation basis for development of partograph on the basis of observation of large number of women in labor. After that, the composite picture of labor was reported by Philpott in 1972, who combined detail of progress of labor together with information about fetal and maternal condition. There are some advantages of using partograph. A single sheet of paper can provide detail of necessary information at a glance. There is no need to record labor events repeatedly. Gives clear picture of normality and abnormality in the labor. It can provide deviation from duration of labor, so appropriate steps could be taken in time. Some other advantages: it facilitates handover procedure of staff, save working time of staff against writing labor notes in longhand, educational value for all staff. Now the principles of plotting partograph. The active phase of labor commences at 4 cm cervical dilatation. The latent phase of labor should not last longer than 8 hours. During the active labor, the rate of cervical dilatation should not be slower than 1 centimeter per hour. The cervical dilatation should be 1 centimeter per hour. That is okay for further labor. A lag time at 4 hours between a slowing of labor and the need for intervention is unlikely to compromise the fetus or the woman and avoid unnecessary intervention. Now the method of recording partograph. First, patient information. Fill out the name, gravida, para, hospital number, date and time of admission and time of ruptured membrane. Then fetal heart rate. The rate of fetal heart rate indicates the state of fetus inside the uterus. Record every half an hourly. Now the amniotic fluid. Record the color of amniotic fluid at every vaginal examination. I indicate membrane intact. C. Membranes ruptured, clear fluid. M indicate meconium stained fluid, and B indicate blood stained fluid. While you do a vaginal examination, after the vaginal examination, you have to put the symbols of these indicators. In the next, molding. Molding is a state of reduction or loss of space between skull bone. Presence of increased molding of the head high in the pelvis indicates CPD, cephalopelvic disproportion. Recording of degree of molding is 0 indicate bones are separated and sutures can be felt easily. 1. Sutures are opposed. 2 indicate sutures overlapped but reducible, and 3 indicate sutures are overlapped and not reducible. Now the next assessment is cervical dilatation, assessed at every vaginal examination and marked with the cross sign. Begin plotting on the partograph at 4 cm. This graph consists of homogeneous squares, 10 squares vertically. Each square indicates 1 centimeter of cervical dilatation. Now you can see a cervical dilatation graph in the partograph. You have to start with the force after 4 centimeter of cervical dilatation and plot a cross sign after every assessment. Now the cross sign in the graph are joined by the continuous line. Begin plotting on the partograph at 4 centimeter. The climbing tendency of this line normally lies on the left of the middle of the partograph. Alert line, a line starts at 4 centimeter of cervical dilatation to the point of expected full dilatation at the rate of 1 centimeter per hour. Action line parallel and 4 hours to the right of the alert line. And the next assessment is the descent of the head. This is assessed by abdominal examination. Before doing any vaginal examination, refers to the part of the head divided into 5 parts palpable above the symphysis pubis, recorded as circle at every vaginal examination. As you can see that in this picture, you can see the descent of head in 5 by 5. Head is in the pelvic prim. Slowly and gradually, it will goes to the 0 by 5. There where you can palpate the occiput, sinciput through the vaginal examination. Now, the what do you mean by hours and time? Hours refers to the time elapsed since onset of active phase of labor, and time is record actual time. Now, after that, you have to record the uterine contraction. Uterine contraction are recorded graphically on the partograph according to their strength and frequencies. Observation of contraction is made half hourly in the active phase. Palpate the number of contraction in 10 minutes and their duration in seconds. Here we can see how we have to plot a uterine contraction in partograph. If less than 20 seconds, we have to dot it in the partograph box, and between the 20 to 40 seconds, we have to cross the zigzag a line in 20 to 40 seconds. If it is more than 40 seconds, we have to darken the contraction box. This is the section we have to put the uterine contraction in a dotted way or zigzag line or in a darkened way. Now the recording of oxytocin rate. This consists of two lines as you can see in this picture. One for the record of unit of oxytocin per liter of intravenous fluid, and other one is for the drop of fluid per liter you have to infuse. The recording can be made at the interval of 60 minutes as the uterine contraction occur. Other drugs and intravenous fluids are recorded in partograph also. Record any additional drug given and are recorded at the particular point of time. This includes sedative, antibiotics, IV fluids, etc. The name of drugs and doses given should be written clearly in the long box. In the next, we have to record a maternal condition also. Pulse, record every 30 minutes and mark with the dot in the pulse area. And blood pressure, record in every 4 hourly and mark with the arrows. In the down line, we have to record the temperature in every second hourly. In the last, urine analysis should be recorded also. During the course of labor, the examination of urine is also important. In case of maternal distress, the volume of urine may decrease and it may contain ketone bodies. So we have to take a keen observation in urine analysis. So this is how we all put a partograph during the labor. Thanks for watching. Like and subscribe my channel.